Welcome to Aesthetic TV. I'm Michael Moretti, coming to you from the stage of the Aesthetic Show. I'm sitting today with Dr. Beverly Johnson, a seasoned medical and cosmetic dermatologist and skin care surgeon who is here to talk about her practice, which is located in Silver Spring, Maryland. Thank you for joining us today, Dr. Johnson.
Thank you very much for having me.
So, Dr. Johnson, we're really interested to know what are the top procedures that you offer to patients in your practice that are the most unique and special to your type of practice?
Well, I would have to answer that right now, the one thing that's revolutionized my practice is my laser. So it's an ND YAG 1064, but this particular laser it's compact and it does a lot of things for all of my patients. It's sort of like one-stop shopping.
Oh, really? Like a Swiss Army knife of lasers?
Exactly,
yeah?
exactly. Or an iPod or something. iPad, rather.
So it's multifunctional.
Exactly. Yeah? And I love it. And if I could do it all day long, I would. But I have to do other things, treat medical patients. But you can treat all skin types. And there are a lot of different issues that it will address, including like age spots, dark hair removal, skin tightening, all in one.
What about veins, small vascular problems?
Well, most of us who've been around a lot know that the laser isn't the first thing you reach for with leg veins. That's like the last thing you do.
I see. Okay.
What's left over after sclerotherapy, then we reach for the laser.
And I'm curious, so for patients, we say with skin of color, like dark skin patients, African American, Asian, can you use this laser to treat them?
Absolutely, absolutely. Now, you can make a mistake with any laser, but this laser is safe. In the right hands, if you know what you're doing, it's absolutely
So your patients with dark skin don't need to be afraid because you're so confident with the laser and how you use it.
That's true. With any laser in any patient in any office, if it hurts you, it's probably not right.
So
something's wrong.
Pain is a good warning signal.
Yeah, if it hurts, you should get up and,
So, I'm very curious about your background. Can you tell us a little bit about your backstory and why you decided to specialize in dermatology?
Well, I was fortunate to meet a dermatology resident when I was in medical school. But going back earlier than that, I was a 15-year-old whose mother took her to the doctor. And so the doctor was trying to make small talk with me, and he said, well, Beverly, what do you want to be when you grow up? And so I didn't know, so I said, I want to be a doctor like you, Doctor, I won't say his name. He said, no, my dear, you're too pretty to be a doctor. And so that made me mad. And after that, I wanted to be a doctor.
So it was a challenge.
Exactly.
Yeah.
Don't tell me I can't do something. So then I went to Northwestern University, and from there I went to Howard Medical School in DC. And thanks to the United States Public Health Service, I left college or medical school without any major debt. But I had to work for the Public Health Service in Belle Glade, Florida to pay them back.
Oh, I see.
So that was very interesting. And
Did you work for a veterans hospital there?
No, I actually worked for a migrant farming community in Belle Glade. And I think I saw everything that the skin can do.
So it was incredibly educational for you to work there,
I've seen it, yeah. They had mango poisoning, they had leprosy. It was just a...
Mango poisoning.
Right, there are people who are allergic to mango.
Oh,
and it looks like poison ivy.
They break out in hives and rashes.
They get the rash that a poison ivy would give you if you were allergic to poison ivy. And
now I also understand that you specialize in skin of color, and particularly African American skin types in your practice. Is that correct?
Actually not. I mean, people will look for a physician of color and they'll find me, but I think of myself as a skin care expert.
In general?
In general, and I see a lot of patients who are senior citizens because I also work at a nearby community that, and very few of them are African American.
And so these days, for your cosmetic patients, what are they asking for mostly when they come to you?
Well, my favorite cosmetic patients are asking me what I think they should do.
Oh, like for a consultation.
A consultation is perfect, but when you come in and you say, how much do you charge for Restylane? and how much will it cost? And I might say, well, you don't need Restylane. You might think of Botox or some
see.
cosmetic products to,
But you prefer patients to ask you for a consultation rather than telling you what they think they need.
I think everyone feels that way.
Sure,
Yeah.
sure.
Because as a skincare expert, you kind of know what's going to work and what isn't going to work. And so if you ask for a product and you don't need it, they might give it to you anyway, and you end up looking like a platypus.
Oh, that would be bad.
Yeah.
So when you have patients come to you that have been shopping around and going to other practices or on the internet, what do you think it is about your practice that makes them decide to stay with you and to have the treatments done by you?
Well, I've actually felt that a lot of patients think that they're members of my family.
Oh, really?
Yeah, they want to call me and ask me a lot of questions, but I think I treat patients as though they were a member of my family, that I care about them and not necessarily trying to sell them anything. And mainly I feel like I'm a teacher. I'm going to try to tell you what I think you should know.
Rather than selling them, you're trying to teach them about skincare.
Right. I'm not going to sell you something you don't need, but I might try to change your mind about what you think you need and tell you why you shouldn't be putting mayonnaise in your face or something like that.
Right. So I'm curious, when a patient comes to you for a consultation and you sort of start that process, where do you begin, and how do you have the conversation with them?
That's a very good question, and it kind of always goes like this. Mr. Smith will come in and say, I'm sorry that I look tired all the time, or people are telling me, there's usually a chief complaint, so to speak, and I might put the mirror in their hand and say, well, what do you see? Well, what do you think is the problem? And they might typically point to this. And they'll say, well, what about Botox? And I might say, well, this isn't where Botox goes. And while they're talking to me, I'm looking at them and seeing what I would do if I were them.
So usually the conversation starts with finding a problem or identifying a problem area that the patient has.
Something makes them come in and ask. Whether
like
it's
a motivator.
Right.
Yeah.
Sometimes it's the wife, sometimes it's the boss, or sometimes they are looking forward to going to their high school reunion.
Oh, like a special occasion.
A special occasion.
Yeah.
Or it's a birthday with a 0.
And then you can
They
just start
come in.
building from there.
Right. But I find out why they're there, because I don't want to just throw something out and they had never thought about it, because that would be rude.
Okay, I think that's a very logical process, and it probably makes the patient feel very comfortable. Do a lot of your patients stay with you over time? Do you have many long-term patients?
I do. I really do. I've been in this area for 30 years, or more than 30 years, and I've seen patients who were children now are parents.
Oh, I see.
And that's very exciting.
Yeah, from pediatric to adult, the whole gamut, right?
In fact, I just put a put together before and after. It was a picture of me holding a boy, and his mother, who was my patient now, said, put a little caption on it, one day I'm going to be your dermatologist. And the little boy says, Derma what? And then I have a picture of him as a 24-year-old patient.
Oh,
who is
great.
my patient. Yeah.
Great. So your attitude is that you treat your patients like you would treat your family.
I try.
Okay, that's wonderful. Now I understand why you're so successful. So
thank you.
Thanks for joining us today, and I really wish you the best of luck with your practice.
Thank you so much.
For Aesthetic TV, I'm Michael Moretti. Stay tuned and stay beautiful.